Probably can get started. I am Hongju Huang. I'm the current director for counseling and psychological services. This is my less than 100 days since I started. It's really good to be here. Really seeing you, and also hopefully I can talk about our services. Also, if you have any questions I can address, that would be great. I know that many of you are teaching, right? You interact with the students, and I'm pretty sure that you have that, maybe as a person, as a professional, we have your value of being a helper, or teacher, educator. All these categories actually, we are in this, I think, business because we want to help others learn, help others to get better in whatever they are doing. So I'm in that same boat actually. That's why I became a psychologist. And I have been in this field for about 15 years. I only worked at university counseling centers, different kind of counseling centers. My role before this was a little bit different. I was a therapist, I was a research coordinator, assessment coordinator, and I was a training director, and now I'm the director for this center. So I feel very privileged to represent our center today. Before we get into about our business, what we do, probably you know about a little bit, and address any questions, I want to do some introductory activity with you guys. What do you think is the one most important thing as a helper you need to have? Anyone?
As a helper, I'd say empathy. Very important.
Exactly. I was actually going to that. So there are many ways actually demonstrating empathy. This is kind of remotely related to it, and some people use it in their activities too. So if you don't mind, maybe you've been sitting for a while now, so you can stand up, and we'll take about a minute. Let's do this activity together. Find your partner, so pair up. Find your partner and face each other. Sort of keep whatever comfortable personal space between you guys and face each other. And I'll give like a 1 minute per person. So what you need to do is that you are going to mirror the other person. So one person will do whatever motions and looks, whatever facial expressions or postures, and then the other person has to mirror that, okay? So you need to just mirror whatever the other person is doing. So think about this is sort of attunement practice. It's part of the empathy building practice. Anyway, so take turn. I'll give 1 minute. One person goes first, and then I will stop after 1 minute. So, are you ready? Yes. Okay. So, one person goes first for a minute, and then we'll switch. Make sense? Okay. I'm going to time it. Hold on.
Oh,
I'm going to time.
we're like going.
Okay. All right. I'm going to time 1 minute. I said, if you are ready, set, go. You have 1 minute. No words. Thirty seconds left. Five, 4, 3, 2, 1. Stop. All right. Okay. Now switch. Now switch. Okay. Now switch. Okay. Are you ready?
Ready.
Oh, we're already doing it. Ready? We get 5 seconds.
Are you ready? Okay. Set, go. Thirty seconds. Ten seconds. All right.
That was lively. Very nice.
So, well, good job, everyone.
We ran into the same problem.
So, congratulations, you passed.
Oh, good.
Now, this is part of the exercise actually. There are a lot of probably other exercises I can introduce to you. Pretty simple. But I was wondering, how was your experience trying to mirror the other person? Was it hard, easy, funny, uncomfortable? Anyone wants to share briefly?
I had to make sure I didn't talk the talking part. So being silent sometimes a little difficult. But then once I just started really focusing on her moves,
Mm-hmm.
then that helped me just concentrate on her movement. And she had some really good moves, some fun moves. So it was great. I enjoyed it.
So what you're saying is that when you're really able to focus on your partner, it was easier for you to follow, understand.
So I wasn't distracted by
All right. Anyone else?
We smiled a lot. Like it was nice. Like I felt like I could feel her energy. We were like really kind of like smiling and enjoying.
How did you take it? How did you take it? How did you interpret that smiling?
I think this like a good, like we felt good. Good feeling.
Good feelings. Okay. Anyone else? One more person.
I was the opposite. I was smiling because I was uncomfortable. It's a coping mechanism. It's like,
And a good
but
one.
yeah, it was uncomfortable for
Yep.
me because I didn't know if I was doing it right and the minutes seemed really long.
Thank you for actually acknowledging that it's not that easy. Right? It's not that easy trying to do the right thing or trying to be correct. There was one more person actually.
Oh, I was just going to say we were doing some stretches and moves, but we kind of got on the same page eventually, and we even did similar things, so we kind of were adapting to each other, I felt like, so.
So that's okay. There's another aspect. So once you get rolling, it was easier, right? It was easier. You focused, and then maybe you passed that uncomfortable feeling phase, and then when you get rolling, it was kind of feeling more comfortable, easier. Okay.
You're not going to like this comment, but I was taking it outside of the context of mirroring physically
Okay.
and looking at it more in real life and mirroring behaviors of someone. I thought, this could lend itself to enabling behavior as opposed to showing empathy. So I hope you touch upon the distinctions between empathy and enabling maladaptive behaviors.
That's interesting. That's an interesting perspective, actually. You could interpret it that way, right? it all depends on your intention behind of your behaviors, right? You think about what is my intention of really focusing on other person, trying to mirror, and trying to be really understanding of the other person's next move or whatever. So I think it depends on your intention behind this practice, and whenever you talk to your students, what is your intention, right? So think about that when you're trying to differentiate. But thank you for sharing that aspect too. So thank you for indulging this activity as an introduction. So counseling services. So we exist on campus. Our mission is actually trying to provide counseling and psychological services to our students. We don't see staff faculty, but you know that there's other resources for staff and faculty. Faculty staff assistant program. Korea Tool is the person. Actually, she reports to me. So if you have any questions about that, let me know. I can refer you to that person. So think about that. In your role, faculty and staff, and I'm pretty sure that there is a varying degree on occasions you need to interact with your students. And then as you also think about your role, sometimes, I wonder what's going on with this person. Sometimes you feel that this person, your student in front of you, not doing well, right? So, and then what would be your choice, your intention behind of it, right? Will you try to be helpful? I'm pretty sure that most of you will try to be helpful for your students. And what should you do? I think understanding, this is practice again, is really tuning in into the other person you're talking to. We are trying to understand what the other person is experiencing. Understanding a student's experiences could vary. There are commonalities among students, particularly for new students. They are going through a lot of adjustment. This can be challenging. Very unique aspects of each student, as you can imagine, right? So those things, you're really mindful about trying to understand the students. So here, I mean, our students are working hard. I believe that. Most of our students are really working hard in class, outside class, and studying for exams and homework, all those things. But at the same time, they are dealing with a lot of other things outside of classes, right? This might be their first time away from home, really trying to establish their own personhood, establish independence, trying to figure out how to live daily life, manage their classes, friendships, relationship with the faculty and staff, their advisors, all those things for the first time, particularly for first year students. So when they're going through all these things, sometimes something goes wrong. It can be very daunting to some students, particularly if you understand what kind of students we are working with nowadays, particular. Well, it's Generation Z or other kind of generation, new generations. There are slightly different kind of characteristics depending on different generations. What kind of things do you notice? The younger students, freshmen, and this generation of students, did you notice difference? Then, for example, students maybe that you dealt with 5 years or 10 years ago, if you worked here for long. Maybe you have. Also, if you have children, for example, if you have parents, and anyone has children, and do they have iPhone, iPad, this kind of technology, they have access to it? These younger generation students, they grew up with this technology all the time, using it. The downside of it, as you probably know, that sometimes these students are not really good at, interacting with other people in person, because they all do is like they text with each other. They avoid uncomfortable situations. Therefore, they have a lot of them, including my daughter, social anxiety. A lot of anxiety coming into college. Guess what? What is the number one mental health concerns among college students? Anxiety. Exactly. So that's there are a lot of factors to that, but this is sort of the way they grew up, how they socially interacted or not. This actually contribute to their anxiety problem a lot. And also other factors, external factors. We deal with social political environment issues a lot, right? Also economic issues. I know that 12 years ago, for example, the economy went down. A lot of people lost jobs, and family members lost jobs. That impacted their experience, our student experiences. We have a lot of first generation students who may be financially struggling, right? So think about all these things. And this is just a simple practice, just really tuning in with your partner, someone in front of you, trying to really focus on that person rather than you. That's, I think, a basic thing, first thing you can think about when you're trying to help someone, really trying to listen, trying to tune in, trying to understand, okay? So, as Carmen mentioned, probably someone else mentioned, I'm pretty sure you have your own knowledge and skills in terms of trying to help someone else. You may have some knowledge about how to deal with certain stress. You can provide advices or not, that's fine. I really encourage you to do that actually. First, try to really listen and understand what's going on with this person, if you have time. That's another thing, right? Sometimes you're so busy. Oh, do I have time for this? Maybe, maybe not. But if you have time, maybe make yourself some more available and try to understand. And then try to provide help as much as you can. Sometimes that's it. The students just need that. Not all the students who are dealing with some stressors in their life, not all the students needs counseling from us. Maybe that encounter, really kind-hearted, caring person like you, just having that 5-minute conversation was enough, right? But sometimes, okay, still you sort of wonder about, if after hearing about, oh, this is I cannot help, even if I try to help. Then remember us. So the issues we are dealing with when students coming into our center, asking for our services, there are a variety of issues. It's not just limited with anxiety and depression. There are a lot of issues. In fact, there are a few national organizations collecting data about presenting issues for college students at University County Center. Anxiety, number one, depression, and then it depends on how they collect data, it varies. But the third one tends to be like relationship issues. For me, it's not surprising. Again, it's a combination of these students didn't have real good opportunity to interact in social situations in person. So they are deprived of these opportunities while they are growing up. A lot of students have been sort of overprotected by parents, and I may be somewhat guilty of that too. We care about our children. We try to protect and provide opportunities to them as much as we can. The downside of it, it's us also the system itself. All this college system has become a lot more competitive now. That's another reason why students are so anxious. They're anxious if they don't get A, for example. And a lot of students are probably straight A students coming with a 4.0 GPA. First semester got C or B for the first time. It's devastating for them. But we know that happens. It's a different environment, and so a lot of anxiety. So there are other issues we can address. Some of the issues can be pretty serious. Even if talking about anxiety can be pretty serious. Some people may develop some panic attack issues. Not just anxiety, I worry about things that's physically manifest. And then sometimes it gets severe, a lot more than that, and sort of having panic attack. So it varies within these categories. I can see all of these things can happen. Also, I want to normalize some of this experience to us too. All of us actually, in our lifetime, sometimes we experience some of these things too. But most of us do not need a professional help because we have enough support. We have friends, family members you can talk to. Also, you have information, ideas, and then you can resolve some of these issues. But sometimes, amongst us too, students or not, getting professional help can be actually best option. Okay. So we offer these counseling services. So pretty typical. I found that our counseling service here, the services we offer is pretty typical for College Counseling Center. We provide individual, couple, group counseling. We rely on brief counseling model. As you imagine, this is something that if you didn't know, there are always more students once they receive services. A lot more than we can actually handle. This is sort of dialogue has been happening among university counseling center directors over the last decade or two. How we can really manage all these demands, how we can meet the demands of services. So, we have limited resources. We have, say, 12 clinicians, and then there's always the demands go up. How do you do that, right? So we try to be creative of that, and bottom line is we need to be very effective in our services, in our system. And one of the approaches most of counseling centers take is actually brief counseling. Used to be, like say 20, 30 years ago, there was less demands than this, maybe enough counselors. We used to see clients, 12 sessions, 20 sessions. Now we cannot do that, right? So the number of counselors stays same. I think I found that it is true for our center here too, last 15 years. Same, or actually we lost 4 of them 10 years ago, 12 years ago. Now we refilled last year or a couple of years ago. So now here back at that level, the demands continue to go up. Therefore, we need to really manage this. So we have this model, and we have walk-in. So we noticed that some of the trends among college students, mental health issues, is that a lot more crisis, related to anxiety issue too, a lot more crisis student experience. So for that, we have a walk-in services every day, 8 to 5. Students are in crisis. You think that your student in crisis, trying to talk to your student, trying to help. Still, what kind of crisis, whatever crisis is. Sometimes it may contains maybe suicidal ideation. Really, they cannot think that they can stay safe for some reasons, and whatever that is, so brings out sometimes crisis, emotional crisis. Then they can walk in towards the center between 8 and 5. And what you can do, if you have again time, you can walk over that student to our center. The best thing you can do at that moment is to stay until actually the student actually meet the crisis counselor, so you can sort of do the warm handoff, right? That'll be really, really helpful. Okay. And did you know that we have also after 5 p.m. you can call. We call using our number, general number. That call will be transferred to a crisis call. There is a counselor taking this crisis call, so you can utilize that services as well. I really like that. Also, we provide a lot of outreach and consultation too. If you have any questions about services, or if you have a situation, I'm not so sure how to help this student. I have some questions about things. You can call us. You can call me, you can call us, okay? This is our business hour. Talked about urgent, same walk-in assessment, same-day walk-in assessment, after-hour telephone support. And as you know, that our services are confidential, and there are only 2 places on campus, usually. It's privacy law. The government law is pretty strict about that. So mental health services and then medical services. So health service and us is governed by something called HIPAA. It's a federal law that we need to really protect our clients, our students' private information. So without their permission, we cannot reveal anything actually, technically. But there are some exceptions when you're trying to deal with a really serious crisis. We need to coordinate with some efforts on campus. Sometimes there are some exceptions, but for the most part. So sometimes faculty and parents call, I know that's so and so. Joe is seeing one of your counselors. I know, right? Okay, we cannot actually confirm or deny of that service. Even confirming or denying, like no, or particularly say yeah, that's a breaking the law for us. So hope that you understand that aspect of it, because we don't want to break the law while we are providing services. So this is our website. If you have any questions, and let me know. I know that Carmen talked about a red folder. That's one single login page. You can find that. Also, you probably have this one. That's information. I don't know. Yeah.
Yes.
Anyone went over the contents of it? We usually do not go over the specifics of the content unless there is a request for it. So if you need to, just let me know. Other than that, I just trust that you will read it later. Sometime you have time, and if you have questions about that content, also let me know. Okay, I think that's all. I have 25 minutes. Do you have any questions? Any questions? Okay. Yes.
As a faculty here, I'm just curious, what do you feel is, with all your experience, what are some of the things we can do to accommodate students and be supportive and empathetic and available to them? What do you see that looking like in the classroom?
Yeah. So absolutely, as a faculty person who is in charge of your class, it's absolutely up to you, right? So I want to suggest that think about some principles behind of that accommodation for yourself, how you manage your classroom. You have, say, 50 students in your class, and then how you can equally also compassionately apply some of these principles to your student. If you say yes to certain things to one student, are you able to say yes to other students with a similar or same conditions? Think about that too. Also, of course, there disability, so law requiring accommodations through disability, of course, you need to abide by. Hopefully, you can abide by those things. Other than that, there is a murky area. I think it's all, I think it depends on your principles, how you want to approach that. Personally, I would approach, if you think that this is helpful for your student learning, I use that as a principle. Is it really going to help my student learn? Whatever the outcome is, right? Is it result in better outcome, desired outcome? Giving 1-2 more, extension of deadline for your homework may help this student because this student was having some issues last night, whatever. That's a small thing, right? Maybe I would say yes. Sometimes maybe not. So I think again, that's based on your principles, understanding about these students. So that's going to be challenging for all of you, for me too, since you don't have a lot of time to really understand. But ideally, you know each of your students that where they are at or their condition. Therefore, you can sort of trust them when they say this has happened. It's happening. Okay, you trust them. Versus if you don't know, it's hard to trust them. Anyway, I would think about that way. Mm-hmm. Any other questions? Nope. All right then. Thank you so
Thank you
much.
very much.